As the implementation of the Affordable Care Act, or Obamacare, progresses, the Department of Health and Human Services is taking away the religious freedom that all Americans are guaranteed by the First Amendment by requiring that all employers, regardless of religious conscience, provide all forms of contraception to their employees and even to minors without the knowledge of their parents. In response to this assault on the Constitution, Catholic leaders are stepping up and are searching for what can be done within the bounds of the law to deliver quality health care that follows the ethical and religious directives for Catholic health care services. The Make Straight the Pathway Conference was held in Houston, Texas in March of 2013 on the campus of the University of St. Thomas to shed light on the critical problem of providing quality health care and protecting everyone's religious freedoms.
Hi, I'm from Washington, and I'm here to help you. It gets funnier every year, doesn't it? These two presentations fit together very well because I'm going to sort of bump you up about 100 years, and I have some good news and some bad news and some newer good news. The good news is that the traditions that Mr. Barton talked about had on protection and protection of and respect for rights of conscience had been respected in health care by and large by our federal government until only a few years ago. And I'm going to give you a little overview of the consensus, the bipartisan consensus that had affirmed laws protecting rights of conscience in health care until quite recently. The reasons, the bad news is the ways in which those laws have been ignored, gotten around, evaded, and rendered a lot less useful than they need to be. And finally, I want to talk about our efforts to restore that consensus and that protection. So, there are many federal laws actually that affirm a right of conscience in healthcare. I'm going to talk about very briefly about the three most important ones. And this trend began right back in 1973, right after Roe versus Wade, the abortion decision, with the Church Amendment. It continued in the 90s with laws like the Coates-Snow Amendment, and finally in 2004 and in subsequent years, the Hyde-Weldon Amendment, which even throughout all of these debates about conscience has been approved by Congress and signed by Republican and Democratic presidents every year as part of the annual appropriations process from 2004 to the present. So to give a little more detail about each of those, the Church Amendment is not named after the Catholic Church. It's named after Senator Frank Church, Democratic senator from Idaho. In 1973, there were two threats he was addressing. First was Roe v. Wade itself. In the wake of Roe versus Wade, with the Supreme Court saying that abortion had the character of a fundamental right, the pro-abortion attorneys started to say, well, that means that everybody is entitled to an abortion. Everybody has to have ready access to abortion. So the people who object to abortion need to back down and help provide it. There should be no right of conscience. And in 1973, people thought, well, maybe that's the right interpretation of what the Supreme Court has told us. You know, if you say that voting is a fundamental right, then nobody can get in the way of your right to vote. So maybe that's what that means. Congress said no. Congress said no. People have to have a right to make a choice against abortion as well. And the other forcing event was a decision by a federal court in Montana that said a Catholic hospital in Montana, because it received federal funds, had to perform sterilizations against its conscientious beliefs because it was the only hospital in the area that provided a ready facility for doing sterilizations. And Congress responded to both of those. There are subparagraphs to the Church Amendment, B through E. A disappeared at some point, I'm not sure why. But subsection B is to address especially this Montana situation. The receipt of federal funds, and there are certain specified federal programs, cannot be used by a court or other public authority to force an individual or an institution to participate in abortion or sterilization. So even then, the conscience rights we were talking about went beyond even abortion itself into, into the family planning arena with sterilization, contrary to moral or religious convictions. Subsection C said that entities receiving federal funds may not discriminate in employment and training and education against medical students, nursing students, for example, because of their views on abortion, or in sterilization. That actually, and that provision is sort of double-edged. It means you can't exclude someone because they favor abortion either. We're talking here about a right of conscience in the deepest sense, that is, one's simple views on the moral issue, as opposed to whether you're performing them or not. Subsection E talks about medical schools in the same light. There's another part of subsection C that says, if you're an entity that receives federal funds for biomedical or behavioral research, you may not discriminate against healthcare personnel because of their willingness or unwillingness to take part in any lawful health service or research activity in accord with their moral and religious convictions. So it actually goes beyond abortion or sterilization. It would certainly cover contraception or fertility treatments or anything else that somebody really has a moral or religious objection to. You can't make them do that as a condition for being in that program. And subsection D, which I think has been unexplored in terms of its potential impact, because it's really very broadly stated, and this is a direct quote, the others were paraphrases, but that no individual can be required to perform or assist in the performance of any part of a health service program or research activity funded in whole or in part under a program administered by the Secretary of Health and Human Services if his performance or assistance in the performance of such part of such program or activity, I love the way lawyers talk, would be contrary to his religious beliefs or moral convictions. That covers objection to anything in any program, any medical program that receives funds from HHS. And of course, with one thing about the passage of the Affordable Care Act is that there are a lot more medical programs now that are funded in whole or in part by the Secretary of Health and Human Services. A lot of us have voiced concern about that in terms of the federal government increasingly taking control. On the other hand, it means those programs are, in theory, covered by this conscience amendment. Now, Code Snow was also named after its sponsors. It came some years later in 1996, and it is written into the U.S. Code. It was actually passed as part of a Budget Reconciliation Act and signed into law by Bill Clinton. And it was responding to an effort by the ACGME, Accreditation Council for Graduate Medical Education, to require that all OBGYN residency programs provide an opportunity for abortion training. And it was also saying, in effect, that medical residents should have to get that training. And the government responded with this amendment saying that no federal agency, no state or local government receiving federal funds could discriminate against an individual or institutional healthcare provider for failure to provide abortion or abortion training, to receive such training, or to refer for or pay for such abortions or training. Now, even though to us who helped put it together with primarily with Senator Dan Coates, it seemed to us that this covered the field, abortion or training. It's been interpreted by a lot of others as applying only in training contexts, and that makes it much more narrow and less effective than it could be. We don't know what a court would say to that because there's some ambiguity in the amendment, but that's one of the problems that makes it less powerful than it could be. And that's one reason why we followed up in 2004 with the Hyde-Weldon Amendment, which was passed as an addendum to the Hyde Amendment that's against federal funding of abortion, with the help of Congressman Dave Weldon of Florida. And this took the policy of Code Snow and clearly applied it to the full range of individual health professionals, doctors, nurses, pharmacists, and the full range of contexts where abortion might be involved, performing it in training contexts, non-training contexts, referral, paying for it, arranging for an abortion or an abortion referral. And this is actually the broadest. The major drawback to it is that it only protects you against discrimination by a governmental body, either a federal governmental body or a state or local government that receives federal funds. It had to be written as what they call a funding limitation rider. Usually, trying to put something onto the annual appropriations bills is subject to a point of order and could be knocked out unless it is stated in the form of none of the funds under this act may be used for. So none of the funds in the Labor HHS Education Appropriations Bill can be used for a governmental body that discriminates in this way. What's one of the big problems under the Affordable Care Act? It provides billions of dollars in its own funding that bypasses the Labor HHS Act, so it's not covered by this. So this is just the text of the Hyde-Weldon Amendment. Defines healthcare entity that's protected, you'll notice, very broadly. Any individual, physician, or other healthcare professional, hospital, provider-sponsored organization, health maintenance organization, health insurance plan, or any other kind of healthcare facility, organization, or plan. So that's potentially a very powerful defense against governmental discrimination based on declining to be involved in abortion. This one is specific to abortion. There are a lot of other conscience laws. I'm not going to go into the details of those, but because of the focus now, the attention given to the contraceptive mandate, it's interesting to note that the only other time that the government said that contraceptives must be provided by private health plans was when it established standards in the year 2000 for federal employees' health benefits plans. It's a program in which private health plans compete to be put on a list, a book of options for federal employees. They can go through that book and choose whichever one they want, and then the federal government will subsidize the premiums and pay most of the premiums. And the government did impose a contraceptive mandate, and then it turned around and said any insurer that's religious, that has a religious objection. It was not defining whether it's a religious organization, but it said any insurer that has a religious objection is exempt, period. And then it said, in those health plans, any individual healthcare professional, doctor, nurse, pharmacist, who has a moral or religious objection to those items has to be exempt, can't be discriminated against. Now that was 12 years ago. That was the government's attitude towards conscience on contraception. We've come a long way and it's all downhill. The other place where the government had talked about conscience in the context of contraception is when the District of Columbia tried to pass its own contraceptive mandate for all private health plans of the District of Columbia. And I had the privilege of being of help in fighting that with a then not very well-known auxiliary bishop of Washington, D.C. by the name of William Lori, who is now Archbishop of Baltimore and the chairman of our Religious Freedom Committee, who is a wonderful, wonderful man, brilliant man. And he was standing up, and the Catholic Church in D.C. was standing up almost single-handedly against this. And the D.C. City Council, those of us who live in or near there call it sort of a banana republic, but they passed it. It got pocket vetoed by the mayor, who was Catholic. And then Congress stepped in as well in the meantime and said, if you ever do this again, it is the will of Congress that you must have an exemption for moral or religious objections. And D.C. has never done it again. They've never yet passed a contraceptive mandate. That was only, again, 12, 13 years ago. In the AIDS program, PEPFAR, the President's Emergency Program for AIDS Relief, it's one of President George Bush's, I think, greatest legacies, spending billions of dollars on preventing and helping people to survive from the worst life-threatening epidemic in history, primarily aimed at Africa and other third world countries. PEPFAR had a terrific conscience clause. Nobody involved in AIDS work, AIDS prevention or treatment, could be required as a condition for participating in the program to engage in prevention or other activities that are against their moral or religious beliefs. That has made it possible for Catholic and other Christian agencies to participate fully in the program, to be going out there and doing the prevention things that, frankly, really work, like talking about avoiding sexual activity, being faithful to your spouse, getting women out of prostitution, and so on, without having to get involved in condom programs or integrating with Planned Parenthood, which this administration loves to talk about doing. That has been in place since 2003. It was reauthorized in 2008 with actually even slightly better conscience language, closing up a couple of ambiguities. So for the text of these laws, and I don't expect anybody to be writing down all this gobbledygook, but if you go to the website of USCCB, the U.S. Conference of Catholic Bishops.org, /conscience, one of the fact sheets, the top one, I think, will be this compendium, about 8 pages long, of the text of the conscience laws that we need to know about and be able to invoke and remind people of, that there is a history, very recent history, of respect for conscience in American federal law. You can also, well, I'll talk about the other later. Anyway, so why is our problem? What happened here? Well, the problem is that some professional societies have not gotten the message. The American College of Obstetricians and Gynecologists in 2007 put out an ethics opinion report that said there are limits to conscientious objection. There's actually, when they get to the bottom of it, there's a lot more limits than there is conscience. They say people are allowed to their personal view, but when they start acting on them, there's a big problem here, because women must have access to all of these, abortion, sterilization, everything else. And so if you will not do these things, you must be willing to refer for them. Not only must you be willing to refer for them, but you must make sure you are facilitating ready access to it. It would really be a good idea, if you're a pro-life physician, to make sure you locate yourself very near an abortion clinic in order to allow the woman's conscience to get an abortion to prevail. That was a big threat, especially because the ethics standards of ACOG often end up getting written into the certification standards established by their sister organization, ABOG, the American Board of Obstetricians and Gynecologists. And this was the event, actually, that really forced the hand of the Bush administration and Dr. Michael Levitt, as Secretary of HHS, started a process of developing a regulation to better protect conscience rights in healthcare. And he did that by proposing regulations to implement and clarify and enforce those 3 laws I just mentioned, Coates Snow and Church and Hyde-Weldon. And that's the regulation that then got rescinded by President Obama when he came into office. But that was one of the forcing events that began to blow a chill wind across the landscape of conscience. There are also other cases out there, cases in Mount Sinai Hospital in New York, where a young pro-life nurse by the name of Kathy Senzon DiCarlo was forced, under threat of losing her job, to take part in a 22-week elective abortion. She was given the job of reassembling the body parts to make sure they got them all. Had nightmares ever since. Hears children crying in the night. She went to court, and I'll tell you what happened with court. But there's a case where the Department of Managed Healthcare in California has told Catholic healthcare systems that they must provide abortion coverage to their employees, and said that when they said, well, you can't do that under the federal conscience laws, they said, oh, we know how to get around those. There's new federal language on abortion and family planning that suddenly, a year and a half ago, got inserted into the grants for for services to human trafficking victims. This is a program that had been largely run by the Catholic Migration and Refugee Services Agency. It was the main manager of the program and was then referring people out for additional services to other places. All of a sudden, there was a new requirement that in order to be involved in this program, you must make arrangements only with physicians who are willing to provide every legally permissible OBGYN service. So it wasn't just that we were told to refer for abortions. We were told that we could not associate with anyone who was not willing to do abortions. Any pro-life doctor simply couldn't provide any services to women in the program. And of course, we said no, and we were kicked out. And that problem remains in place. We said, but what about Hyde Weldon? They said, oh, the lawyers tell us we're fully in accord with the law. But where can we get that in writing? Well, we don't have anything in writing. That's where it stands. And then there's the Affordable Care Act. There are all kinds of problems of conscience coming out of the Affordable Care Act. It gives each health plan the freedom to decide whether it will include elective abortions, but once it does decide that, it must require every enrollee to pay in an additional premium for other people's abortions, whether they object or not. The Affordable Care Act is not covered by Hyde Weldon because it funds these programs outside the bounds of the appropriations bills. There is a conscience clause saying that health plans may not discriminate against pro-life providers, but it doesn't say anything about the government itself setting requirements that require people to get involved in abortions. And these new mandated benefits lists, there's two of them, the essential health benefits and a separate list of preventive services have no conscience language at all. And of course, it's under preventive services that we've now been told that every FDA-approved contraceptive, as well as surgical sterilization, only for women, by the way, very interesting. No vasectomies, no condoms either, that's not prescription, but prescription contraceptives. And patient education and counseling for all women, that means minor girls as well, all women with reproductive capacity. It applies to almost all health plans. Even the grandfathered plans will ultimately have to comply. And I'm just going to sweep through this because I think a lot of people here know about this contraceptive mandate, that it's unprecedented in federal law. You've never had a mandate like this that didn't have a conscience clause. It's broader than any state contraceptive mandate. It covers self-insured plans. It includes drugs like Ella, just approved recently by the FDA, that can cause abortions. It's very similar to the RU486 abortion pill. The religious exemption is only for a church or association of churches or the specifically religious activities of a religious order. If your religious order prays, it's exempt. If it has an employee that works in the gift shop to sell jams, you're not. That's what specifically religious activities means. Churches, they're integrated auxiliaries and conventions or associations of churches. The administration says that this is really intended basically to cover houses of worship. If you stay in your church building and pray, you don't have to do this. If you teach or serve others or heal others, then you're out of luck. Vast majority of religious organizations are out in the cold. There's no protection for-profit employers, even if they're very devout believers, for insurers, for individuals, or for nonprofit organizations that have a pro-life objection to the abortifacient aspect of this because they're not a religious organization. So the current laws are deficient. They're not doing the job they need to do. Why? Because they only have a very limited scope. Church Amendment, for example, only covers funding under certain federal programs. The enforcement mechanism is deficient because the one thing that the Obama administration kept in its rules was if you have a violation, you go to the Office of Civil Rights of HHS. HHS is the perpetrator here. Kathy DiCarlo whose violation of conscience was in 2009, May of 2009, got a letter from HHS last month saying that her hospital had changed its policy, that wouldn't happen again, and so the case is closed. Never admitted wrongdoing, no compensation for losses or for emotional damage, no punishment at all or penalty on the hospital, just, well, they're not going to do it again, so the case is closed. She was kicked out of court because none of the current conscience laws actually say explicitly you have a right to go to court. And the Second Circuit Court of Appeals said you have to state that explicitly. And under Hyde-Weldon, as I said, the only remedy is to remove federal funds from an entire state or federal governmental body, and the perpetrators of these forms of discrimination are saying, nobody's ever going to do that. Nobody's going to say to the state of California, you're kicked out of Medicaid, Medicare. We dare you. And they've gone to court saying that such a broad remedy is also unconstitutional. So we have very precarious protection there. Solution. Well, you might be hearing later about the lawsuits. As you know, there are at least 48 lawsuits against the mandate, over 140 plaintiffs, for-profit, non-profit, Catholic, other religious. One of the for-profit companies sells only Bibles and religious materials, but the administration says you're a totally secular organization. You have no right. Colleges, universities. The nonprofit suits have been delayed because the government says we're still working on the details of that. The for-profit groups, though, and this slide is a little wrong. It says 12 out of 17 courts have granted preliminary injunctions. I believe it's now 13 out of 18. But the courts are actually getting it. A lot of the courts, most of the federal courts are saying this is a real burden on religious freedom. There's a problem here. Preliminary injunction is not a final decision, but it's a statement of likelihood to succeed on the merits, and a statement about who is really getting most burdened here, the government or this plaintiff. And it's the plaintiffs that are really getting burdened the most because it's their conscience that's at stake. And there's a legislative avenue. Just introduced this week is the Healthcare Conscience Rights Act of 2013, H.R. 940. It was introduced by Diane Black and Jeff Fortenberry, who will be here with us tonight. I'm sure you'll hear more about it then, and John Fleming. And they had sponsored past conscience legislation as well, but they've put all their resources and their energies together on this one bill, because this bill addresses just about all the deficiencies I've just mentioned in the current laws. It was introduced with 48 other sponsors. There are now 67 sponsors and counting. We need a lot more. We want a majority of the House to co-sponsor this legislation. There's no reason why we can't get there. It has, well, three main sections that actually are operative law. There's a section that is basically the same as Jeff Fortenberry's Respect for Rights of Conscience Act in the last Congress. It insists on moral or religious exemption from the new mandated benefits lists in the Affordable Care Act, including preventive services. Rights for individuals, organizations, insurers, as well as sponsors of insurance. The second main provision is the Abortion Non-Discrimination Act, and that fixes the loopholes and deficiencies in the Hyde-Weldon Amendment and puts the right of people not to be discriminated against by government in the area of abortion on a much firmer and more permanent basis. Solves the constitutional challenge about having the only remedy being withdrawal of all funds, because it gives people a right to go to court and to have the court set the appropriate remedies in order to stop the discrimination. And that last section is this right of action. All these laws get a right of action. The Coates Snow Amendment as amended, the new conscience exemption to the preventive services, and the Church Amendment. Everybody who's discriminated against under those, they don't have to go begging hat in hand to a hostile Health and Human Services department. They can go directly to court and get defense of their rights there. And as I say, given the preliminary injunctions that are happening right now under the preventive services mandate, we are doing better in the federal courts than we are with the administration. Finally, what to do? We want to urge Congress to pass this bill, and we want to urge them to attach it to must-pass legislation so that the Senate, which is not as friendly to us on this issue as the House, will have to deal with it. We wanted them to put it onto the continuing resolution the House just approved. They didn't do that. They said they didn't have the votes to do that, partly because a lot of conservative Republicans were going to vote against the bill on fiscal grounds, and then they needed votes from Democrats. And the Democrats are not friendly to the conscience rights issue here. So we need to be putting a lot of pressure on Congress, including the House leadership, frankly, to take this issue seriously as it's taking deficit spending, and get this into legislation that has to be considered by the Senate. We also have a comment period coming up. By April 8th, HHS is going to be receiving, until April 8th, they'll be receiving comments on the contraceptive mandate. And if you want to hear about more about talking points on that, usccb.org/conscience will have talking points on that very soon. And just in general, join the public debate. Insist that what we're talking about here is one of the fundamental rights that any government has to protect, as was said, and that it can't be pushed aside for other agendas of any party. So thank you very much.
Hi, I'm Jeff Gardner, and on behalf of the John Paul II Life Center and the Christus Medicus Foundation, thank you for watching this presentation. The need for more crisis pregnancy centers and Christ-centered medical practices throughout the United States is critical and ongoing, and we'd like to encourage you to get involved. Before you do, there are a couple of important takeaways that we'd like to leave you with. First and foremost, develop a strong and clear vision of what it is you want to create. Be sure that you understand the distinctions between a crisis pregnancy center, a family practice clinic, an OBGYN clinic, a multidisciplinary medical practice, or a sonogram center. Familiarize yourself, too, with the not-for-profit laws as they pertain to healthcare in your state. John Paul II Life Center operates within the state of Texas. Your laws may vary. Also, before you begin either to explore a crisis pregnancy center or a Christ-centered medical practice, get the blessing of your bishop. Get a committed and unified board. If you can, get the cooperation of your local Catholic hospital. Organize and identify physicians who can be key in helping you getting your project off the ground. Develop a strategic plan, and within it include the right professionals, those that you'll need to advise you in all aspects of your endeavor. Familiarize yourself with the fundamentals of fundraising, communication, and education. Everyone involved does not need to know how to do everything, but everyone involved should know about everything that needs to be done. To open a Christ-centered medical practice, understand the financial operations of a clinic. When considering the financial arrangements needed to establish a clinic, it has been our experience that the first-year costs, including salaries, is a minimum of $500,000 and can be supported by a recruitment agreement for a physician with a cooperating hospital. Also, care should be taken to consult with an appropriate practice management company to assist you in setting up the medical clinic and to get the correct assistance with licensing, credentialing for hospital privileges, and third-party contracts, as well as billing and collections with the best electronic medical records and healthcare information technology available. Right now, a national platform is under development to include a service company that will help take advantage of economies of scale so medical clinics and pro-life centers across the United States can be created. For more information, please contact us at Kimberly@jpiilifecenter.org. That's Kimberly at jpiilifecenter.org.